So the first thing that I would do is I'm going to check and make sure that the sink has all the supplies necessary, soap and paper towels. Secondly, I'm going to turn on the faucet and regulate the water temperature. Step 3 is to wet hands and apply enough soap to cover all surfaces of the hands. I will then continuously and vigorously rub hands for at least 20 seconds, covering appropriate areas such as the palms, the back of the hands, between the fingers, the fingertips, and the thumb. I also am going to rinse thoroughly, keeping my fingertips pointed down. I will then dry my hands and wrists thoroughly with the paper towel supplied in the video. I will then discard the paper towel in the wastebasket and use the paper towel to turn off the faucet to prevent contamination to clean hands. Hand hygiene with alcohol-based hand rub. I'm going to apply enough product to adequately cover all surfaces of the hands. I will then rub my hands, including palms, back of my hands, in between my fingers, until all surfaces are dry for a minimum of 15 seconds. Personal protective equipment such as gloves are going to be used by the wearer to protect the wearer and the patient from the spread of microorganisms that can potentially cause infection or illness during medical procedures or examinations. Gloves should be worn if there's chemicals, cuts or lacerations, abrasions, burns, biological agents, harmful temperatures, or extreme infectious agents such as blood, bodily fluids, secretions, or excretions. Gloves are going to be donned by first using hand sanitizer and then using as a standard basic precaution. You are then going to don gloves and then remove them after performing patient care immediately for which they are donned. You are not going to find gloves in contaminated or common areas such as hallways or bathrooms, but you are going to find them outside of patient's room and can also find them in patient's rooms. Soap and water should be used over alcohol-based hand rub when your hands are visibly greasy and or dirty, as well as after you have been handling other contaminants such as biological agents, blood, or other bodily fluids, as well as after handling patients with different bacterial infections and other infections such as C. diff or MRSA, due to the alcohol-based hand rubs being known to be less effective on those biological agents. So the World Health Organization has 5 moments of which hand hygiene is super important. Number 1 is going to be before touching the patient. You're going to clean your hands before touching the patient when approaching him or her in order to then protect against harmful germs carried by your hands. Number 2, before cleaning / antiseptic procedure, you are then going to clean your hands immediately before performing a clean / antiseptic procedure to protect the patient against his or her or your harmful germs against entering the body. Number 3 is after bodily fluid exposure risk. You are then going to clean your hands immediately after the exposure risk of bodily fluids, including glove removal, to then protect yourself in that healthcare environment from harmful patient germs. Number 4, after touching the patient, clean your hands after touching a patient and his or her immediate surroundings when leaving the patient's side to protect yourself and other healthcare environment from harmful patient germs. Number 5, and the last one, is to clean your hands after touching the patient's surroundings. So therefore, you're going to clean after touching the patient, any of their objects and or furniture of the immediate surroundings when leaving, even if the patient hasn't touched them, to protect yourself and other healthcare environments from harmful patient germs.